We got a question recently in our community from a BCBA who wanted to know where to start when it comes to teaching a child to tolerate holding an adult's hand for safety reasons. Our suggestion was to use systematic desensitization. But what is systematic desensitization? Say that 5 times fast. And how can we implement this strategy with our learners? Hi, I'm Shira.
And I'm Shayna. We're behavior analysts who create weekly content about how to teach children with autism so that they make real progress. And we create shareable resources to make your job just a little easier. Today's topic is all about systematic desensitization. That is a tough one to say. And if you want more videos like this, make sure to subscribe and hit the notification bell to stay updated on new video releases.
So this topic made me think of something that's going on in our house now, which is my husband is putting an ice bath in our backyard, and he's very into these, cold plunges, and I've tried them too, and they're pretty cool. But it made me think of that because the way that you build up to, being in an ice bath, or I think that they say you should be able to do like 5 minutes, is by doing it slowly. And so first you might start with like a cold shower and turning the water all the way to the coldest setting and doing that for like 15 seconds, 30 seconds. And then eventually you start getting yourself used to an ice bath and you might only be able to do it for 30 seconds. I know it sounds like nothing, but it's actually an eternity when you're in there. And then from 30 seconds, you go up to a minute and eventually you build yourself up to the point where you can reap all the benefits of being in an ice bath for like a couple minutes at a time. I personally can't do that, but I hear it's great.
No, thank you. Can I use my appropriate protests and say no, thank you? Anyways, it is a great example of systematic desensitization, or what we also can call gentle exposure. Sometimes we use the words gentle exposure because it's kinder and it just sounds like, we're just doing some exposure therapy. And that's what we really want. That's our end goal, is for, people to be able to tolerate, more and more things that they're scared of.
Yeah, and this comes up a lot for I think all of us in doing things that we don't really want to do. We might do it for like a little bit and then a little bit more and then push ourselves a little bit more. And it's that ability to like, tolerate a little bit of discomfort. And that is hard. It's hard for us and it's really hard for our learners, especially when it comes with a lot of like fear. So a lot of our learners might be really scared of things like the dentist or the doctor or getting a haircut. And while sometimes we can get away with like, not going to the doctor that often, sometimes it will come up that we really do need this because the dentist is really important and we don't want them to have to go, under sedation every time they go to the dentist. So it is really important to get them to tolerate little bits of discomfort at a time. And instead of having them go to the dentist chair and like, rip off the band-aid all of a sudden, we want to do it slowly and gently. So we might start with just visiting the office and getting a lollipop and leaving. And then watching mom go to the dentist and mom sitting in the chair. And, you can break down those steps as small as the student needs and then move as quickly as they're showing you that they're ready for.
So essentially, the very first step of any type of systematic desensitization, see, I can't even say it one time fast, Shira. Systematic desensitization, you can do this for the dentist, you can do this for the doctor, you can do this for getting on airplanes, for holding a child's hand. You can do it for so many things, but there are some overarching steps. And the very first one would be to really develop a hierarchy. So take a look at what your student can do right now. Maybe they can't do anything, they don't tolerate anything. Or maybe they do, they can tolerate a little bit of something. So really look at that and then write in those steps. So, okay, so, I think that the very first step, or the step that would be the easiest for them, would be this, or the step that would be the next challenging after that would be this. And really what you want to do is you want to create a task analysis of those steps. And then you would just use forward chaining.
So what is forward chaining? It is a way of teaching where you start with the first step of a process. And as they master that step independently, you add on steps. So if there's 10 steps of the process of going to the dentist, it could be more, it could be less depending on your learner. But let's say there's 10 steps, you would only have the learner do the first one and that's it. We don't even have them do the rest of them because we don't want to push them any more than they might be ready for. They would just do the first step. And as soon as they show that they can do that independently and comfortably, then we would do the first and the second. And then we'd only do those first two steps until they're comfortable and master that. And then we would add the third step. So we're slowly building and adding on more steps as they are comfortable with that.
So if you're looking at something like the dentist, you can do two things. Number one, well, before even going to the dentist, you can get a dentist's bib. You can get, the sunglasses or safety glasses that you wear at the dentist. And you can get a few of those things and teach your kiddos to just tolerate wearing the bib, or just tolerate wearing the bib and the glasses. Just tolerate opening up and saying, ah, after the bib and the glasses are on. In addition to that, you can either wait until that whole process is done, and your child's mastered that in the home, and then go to the dentist. Or in addition to that, you can go to the dentist and just do some walkthroughs. So go to the dentist and walk in the front door and leave, or set it up ahead of time. Usually the receptionist is really amazing, and they'll give the child a sticker or something. I was going to say a lollipop, but probably not at the dentist. Here, have some sugar after I just cleaned your teeth. But walking in, and the receptionist gives a sticker or gives something to your student, and then you walk out and that's it. And you're really pairing that dentist or the hair cutting place or the doctors with a positive experience, instead of having to go in there and actually get the exam done right off the hop, right?
And that's an important point, is always consider reinforcement, right? Because we're asking our students to do something that's hard for them. So instead of just getting reinforcement when they've completed the whole thing and they actually get the haircut or they get the teeth cleaning, we want to build every single step to have reinforcement. So if the expectation is just that they go into the dentist's office, reinforce that. If the expectation is then that they go in and they sit in the chair, reinforcement. And it could be, sometimes it's not inherently reinforcing to go to the dentist. So, like, even myself will get a Starbucks after. So, they can also do something fun after they've done what it is that they need to do. It doesn't have to be something, just leaving the dentist. So, think about reinforcement for your learners when you're breaking down these steps. So, you're also reinforcing each and every step along the way.
And with reinforcement comes differential reinforcement as well. And what does differential reinforcement mean? It means providing a lot of reinforcement for those steps that are really hard, and just a tiny bit of reinforcement for the steps that are easier. So as the students are working through these steps, the current step that you're on might be to open up and say, ah, at the dentist. Meanwhile, they've done a really great job of walking in the door and tolerating the bib and everything else, but it's really hard. So if they don't open up and say, ah, you can still reinforce the other steps by saying, like, wow, that's a really great job, and giving them something to really appreciate that they've done that. But if they actually do the really hard step that you're on, like opening up and saying, ah, then the big party happens.
So back to the example of the hand holding. You want to think about what is the sequence of steps that we want them to do. Is it holding mom's hand to go for a walk down the block? Is it going from place to place? And what is happening right now? What's happening when they're trying to hold mom's hand? Or are they completely refusing? Are they not tolerating anything? And start from there. And let's assume that we want to be able to walk down the block with mom. We might start with mom holding their hand just outside the front door, and that's it. Offer reinforcement. And you could do it by distance, you could do it by time, however makes sense to break down that skill. And then as soon as they're successful, just walking outside the door, maybe you put a special treat for them, like 2 feet outside the door, they walk together holding hands and they get that special treat, and you go back inside. And then you can keep making that treat further and further away, so that they're getting used to holding mom's hand, walking further and further distances.
And if safety is an issue, then you could even practice the skill inside, so that they're safe and they're not running away, in the environment.
And don't forget thinking about how to generalize these skills. Any skill that we teach very systematically, we do want to think about how we're generalizing that to other people, other places, and other times. And for more on generalization, you can check out episode 118 of our podcast.
And for more information on systematic desensitization, click the link in and around this video or in the description to claim your free Tolerates Haircuts task analysis. We also encourage you to subscribe to the channel so that you don't miss any future videos, and leave a like and comment below if you have further questions.